Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today I want to share with you some of the most common diagnoses that I see that tend to be in a front, if you will, and tend to actually mask, cover up that a person has gender dysphoria. Now, there's a cluster of diagnoses that on the surface may look like a person actually struggling with it, but in reality, it is covering up gender dysphoria. And to be very, very clear, this video is for people who do in fact have gender dysphoria, obviously, and who do struggle with dysphoria in any sense, but you're also having all of the symptoms that on the surface starting to look like completely different diagnoses, and you start to think, oh, maybe I don't have gender dysphoria, but maybe I have this over here, and you start to focus on this particular diagnosis, when in reality that diagnosis is covering up gender dysphoria underneath. I see this very, very common, and I see it's very commonly happen, and I know it happens because when I see people transition, or when I see people starting to deal with gender dysphoria and their symptoms tend to alleviate and tend to decrease, this particular clusters that tend to make a particular diagnosis tends to go away. A classic example is depression, for example. Depression a lot of times tend to stem from dealing and living and struggling with gender dysphoria. And on the surface, it might look like you are dealing with depression primarily, when in reality, it is a symptom arising out of gender dysphoria, masking that it is gender dysphoria that needs to be dealt with, and depression is just a byproduct of it. Now, I'm not saying that any of the diagnoses I'll be discussing today cannot exist alongside of gender dysphoria. Validly exists so, meaning that a person may have truly depression as well as gender dysphoria. In fact, that's very, very common. But in a lot of cases that I see, this particular diagnosis that I'm talking about tend to really serve in a way of masking out. Well, it's not that they're masking out on purpose, if you will. It's just that symptomatically they look like a particular set of diagnoses, when in reality, it's actually a cluster of symptoms as a byproduct of gender dysphoria. So some of the most common ones that I have seen, one of them is ADHD and ADD disorder. So ADHD is attention deficit hyperactivity disorder, and ADD is attention deficit disorder. And a lot of people that I see that are struggling with gender dysphoria, on the surface symptomatically, their behavior and also how they tend to relate to things around them on the surface may actually look like a person may have ADHD or ADD and not gender dysphoria. In fact, a lot of people get misdiagnosed initially by having a diagnosis of ADHD instead of getting diagnosis of gender dysphoria. And the reason why it is so common is because when you're dealing with dysphoria, as we know, dysphoria occupies such a big portion of your mind, and dysphoria is something that does not give you any peace of mind. You're going to have a hard time focusing, you're going to have a hard time retaining your attention, you're going to have a hard time concentrating on a particular task, you're going to have a hard time staying really focused and diligent. As a result, on the surface, it's going to look like you may have ADHD. Again, I want to be super clear. As I said earlier, it does not mean that you may not actually have it. And if you suspect you do, it's always best to get evaluated by a professional or therapist in your area. But a lot of times I just see it being something that on the surface looks like it's its own diagnosis. And a lot of clinicians will actually make a mistake of addressing the diagnosis instead of seeing that underneath what's really going on is there's gender dysphoria, which is the primary, which is causing all of the symptoms that look like ADHD and ADD, when in reality it is just a cluster of symptoms that are stemming from having a very hard time dealing with dysphoria. So those are the two very common ones. Another one that is very, very common is social anxiety. And that's when individuals have anxiety of being around people, anxiety being around others, fears that others are judging them, fears that others are thinking about them, the social anxiety of being anxious in social situations around other individuals. And if you think about it, it makes complete perfect sense. You guys who are struggling with gender dysphoria are going to have social anxiety. It's inevitable. But in this case, social anxiety is a byproduct of gender dysphoria, not a social anxiety in of itself. Meaning, when we actually do deal with gender dysphoria, a lot of people's social anxiety tends to just go away. Why? Because you suddenly feel confident, you feel comfortable, you feel good about yourself, you feel good of being in your body, you feel good in being in your skin, you feel comfortable being around there in social situation. But in the beginning, when you do have a lot of gender dysphoria, you will have social anxiety. So on the surface, again, it's going to look like you're struggling with social anxiety, but in reality, that's just on the surface masking gender dysphoria underneath. That's another very common one. Another very common one is eating disorders, unfortunately, whether we're talking about anorexia or bulimia nervosa. And that's also very common with people that have gender dysphoria, because it is a way of attacking the external shell of a body that you don't feel congruent with. For a lot of people, it is an attempt to be invisible, attempt to disappear, not to be in this world. For a lot of other people, it is an attempt to actually swallow your problems and make your problems also disappear. On the surface, it may look like a person is struggling with eating disorder, and in fact, they are symptomatically, but what's really underneath the root, if you want to say, the root of the problem that needs to be dealt with is gender dysphoria. Now, a lot of times, eating disorders and gender dysphoria tend to co-occur together, and so one has to be very careful to distinguish between body dysmorphia, right, and gender dysphoria, two different issues, and I have a video on that. I talk about that as well. So that's another one that I see very common. Addictions. Any forms of addiction are another very common one, whether it is alcohol or drugs or sex addiction, shopping addiction, anything, eating, anything that tends to fall into addictive patterns of behavior where it interferes with your life will a lot of times mask gender dysphoria. In fact, when I work with individuals who have addiction, instead of focusing on addiction, I focus on gender dysphoria first. And people always tell me, well, don't you think these people need to go into rehab, or don't you think these people need to really focus on their addiction problem? And I always say no, because the root of the problem is not the addiction. The root of the problem is gender dysphoria. Gender dysphoria is what causing the addiction to happen. If we take care of the root of the problem and start dealing with gender dysphoria, only then can we start focusing on the patterns of behavior which now have become coping, which are on the surface look like addictions, but in reality they're masking gender dysphoria. So addictions are very, very, very common, including self-harming behavior. That's another that's very, very common. Another one that's where I'm trying to think, there's quite a bit that are on the surface are so, they seem to be so, I don't want to say the word simplistic. They're not simplistic, but there's such clusters. I mean, if you look at these clusters and you start breaking them down symptomatically, they would make such complete sense why they would be there and masking out gender dysphoria. I know that a lot of you guys have been asking me to talk about a much more severe diagnosis, such as schizophrenia, schizoaffective disorders, personality disorders such as borderline personality disorders. You've been asking me to talk about mood disorders such as bipolar disorder, or you've been asking me to talk about autism spectrum disorder. Those are very complex particular diagnoses, and to be honest, I have yet to see personally, this is just me personally, those particular diagnoses to mask gender dysphoria. Now, what can happen is that they can occur alongside with gender dysphoria as standalone individual diagnosis. And if any of you are wondering about cause and effect, it does not mean that being transgender or having gender dysphoria causes any of this diagnosis to happen. Same way as having this diagnosis to happen does not mean that a person will struggle with gender dysphoria. There's no correlation there. They're just standalone diagnosis, just like anybody else in any other segment of population can have standalone diagnosis. And in fact, people do have dual diagnosis all of the time. But we're talking today about diagnostic labels that tend to mask over and actually are not the root of the problem. The root of the problem is gender dysphoria, but what tends to be focused a lot of times, and sometimes clinicians can even make this error, is that they focus on ADHD and ADD, and they focus on eating disorders, and they focus on addictions, and they focus on social anxiety, and they focus on depression and anxiety, when in reality what really needs to be focused is gender dysphoria. Again, it does not mean that you may not have those alongside gender dysphoria. But if you already are struggling with gender dysphoria, you have some of these things that I discussed today, it will be valuable to talk to a clinician to see how this over here might be actually a byproduct of this. So this needs to be always addressed. We always want to address the underlying root problem, because it's from the root problem that things tend to stem forward. If we're addressing the top and not the roots, then we're really not getting to the bottom of the matter. So hopefully this is helpful to you guys today. I know there are a lot of people in comments, I notice, always tell me about, you guys tell me about your social anxiety, and you guys tell me about your depression, and you guys tell me about a lot of other things. And I can see how chances are those other things are stemming because they are symptomatically also byproduct of gender dysphoria, and they're masking or they're sitting on top of gender dysphoria, and it's gender dysphoria at the bottom, at the root of an issue, that tends to bring all of the things toward the surface. So hopefully this is helpful. If you are suspecting you may be having any secondary potential diagnosis apart from gender dysphoria, always seek a therapist in your area. Always seek a professional. Ask them, get evaluation, and rule out any potential diagnosis. It is always best way to go. So hopefully this is helpful, not common. I hope it's not common. Comment below. Let me know. Share your thoughts. Let me know if you yourself had experience with a particular diagnosis masked over gender dysphoria, whereas once you started taking care of gender dysphoria, that diagnosis went away. And that's how usually you know that that diagnosis was really not there to begin with, but it was there sitting on top, masking over gender dysphoria. So comment below, let me know, and I'll see you guys all next time. Bye.